Hello, we are dentists from the Massachusetts Dental Society. This video was made in conjunction with AbleVision to help improve the oral health of individuals with special needs, especially those who have difficulty acquiring adequate care. Is oral health connected to overall health? Yes, poor oral health has been linked with increased risk of cardiac disease and diabetes. And from a nutritional standpoint, it is difficult to eat properly if your mouth hurts. You may be wondering why this is important to you. Well, because you play a significant role in the daily care of these individuals with special needs. In this video, we will give you the tools to help your patients have a better quality of life. For a person that is able to brush their own teeth, you should make sure that they are brushing twice a day for at least 2 minutes. Just observe to see that the patient is reaching all areas of the mouth, especially the cheek side of the upper and the tongue side of the lower, as these areas are most often missed. Flossing should be done once a day. Either single-use flosses or traditional floss can be used. Make sure the person reaches in between all teeth and scrapes off any debris with an up and down motion. And the patient should see the dentist twice a year. Performing oral hygiene on a person who is unable to brush his or her own mouth should be done at least twice a day. First, decide where you will perform the oral health care. Providing oral hygiene services at homes should not be confined to the bathroom. The kitchen or dining area may have more space to allow for easier access to difficult areas in the mouth. Depending on the individual limitations, it may be easier to perform oral health care while they are seated at a table. Next, set up the items you may need. Soft bristled toothbrush. Brushes designed to have the bristles at the optimal angle, motorized brushes, floss and floss aids, toothpaste, cup and water, flashlight, gloves. For a patient that has difficulty staying open or is resistive to opening, a mouth prop can be used. Take care that the mouth prop is placed between posterior teeth, as front teeth could be damaged. It should not be placed on loose teeth. For all adults, a small-headed, soft-bristled toothbrush should be used. An oscillating or rotating, rechargeable electric toothbrush may be suitable for some people due to the small head size when trying to brush in small areas. Toothbrushes can be adapted in several ways to assist those people who have limited manual dexterity. It is important to remember that the technique of toothbrushing is more effective than the actual toothbrush itself. Be aware that some individuals with special needs may be sensitive to noise or motion. Flossing is very important for prevention of tooth decay and periodontal disease because it cleans the space between teeth that regular toothbrushes can't reach. There are numerous products available to help. Floss holders, small brushes called proxy brushes can all help if it is difficult for the patient or for you to use your fingers to guide the floss. Toothpastes are pastes, gels or powders that help remove plaque, a film of bacteria that forms on teeth and gums. Toothpaste comes in different flavors and can have added ingredients to help maintain oral health. For people without teeth, the mouth should still be cleaned out to remove excess bacteria. A soft bristled toothbrush can be used, or a sponge brush, or a washcloth also can help. A tongue scraper can be used to clean the tongue. Oral rinses are commercial over-the-counter products that help remove oral debris before or after brushing. They temporarily suppress bad breath, diminish bacteria in the mouth, and refresh the mouth with a pleasant taste. Therapeutic rinses contain an added active ingredient that helps protect against some oral diseases. Consult a dental professional regarding mouth rinses. It can be helpful to have a container for these items so they are readily available. Preparation is the key to success. Now we will discuss body positioning. Greet the patient and let them know what you will be doing.
Hi John, I'm Othello. How are you today? Good. And John, I'm going to clean your teeth and take care of your mouth today. Is that okay with you? Good.
This shows respect for the patient and should be done even if you don't think they will understand. Next, consider any limitations the patient may have, physical or behavioral. For a patient that has aspiration risks or cannot sit upright, you should consult a dentist, as these patients require special precautions for oral care. You can ask the patient how they would feel most comfortable. For most adult patients, it will be easiest to have them in a seated position.
And John, wouldn't you mind if it's done while in your chair seated at the table?
Yeah.
Good, let's get started, buddy.
Your position must allow you to comfortably see and access the patient's mouth. From the front, you can see, but it doesn't offer neck support and stability for the patient. From the side or back position, you can help to stabilize the head by cradling it in your arm. Also, the side or back position keeps you away from the patient's legs. To review, greet the patient and inform them of what you will be doing. Work with the patient, if they are cooperative, to find a position that is comfortable for both the patient and you, that allows you to have access and visibility. Don't be afraid to try different combinations or to adjust your position during the procedure. Consult a dentist for those patients with special precautions. Once you find a comfortable position for you and the patient, it is time for a brief mouth exam. First, ask the person to rinse their mouth with water. Use a flashlight. Look inside the mouth thoroughly. Check the mouth for any problems.
Looking for cavities, red spots, soles.
Tell the person what you are looking for and ask them to point out any sore or painful spots. Examine the tongue on all sides and note any problem areas.
Okay, looks good.
Continue with your exam, looking for loose or broken teeth, inflamed and reddened or bleeding gums, and any large black holes which may indicate the presence of cavities. Plaque is a mixture of food, bacteria, and saliva. Tartar, or calculus, is what forms from plaque over time and adheres to the teeth and gums. It is often a result of poor oral hygiene. People with a lot of visible plaque or calculus may be more susceptible to poor oral conditions such as those previously discussed. Be sure to also check for any obvious abscess or infection. Should you discover an abnormality, it is recommended to consult a dentist immediately. A healthy mouth should have no visible plaque or tartar and should be free of any ulcers. Just like there is normal variations in skin color, the gums can also have these variations in color from pink to brown, which is normal. Unhealthy gums appear red and inflamed. If there is any concern, please consult with a dental professional. Various hygiene tools can all be very helpful to assist in the plaque removal. Now it is time to clean the mouth. First with a toothbrush. The brush should be placed at the gum line at a 45-degree angle and then moved in small circular motions throughout the mouth. If the patient is resistive to toothpaste, brush first with a wet brush to remove debris. Then add toothpaste at the end. The tongue also should be cleaned with a soft toothbrush or tongue scraper to remove debris. Flossing can be done by wrapping the floss around the middle fingers, leaving the index fingers free to guide the floss between the contact points of the teeth. Then wrap the floss to form a C shape and gently rub to loosen the plaque. Floss aids, as previously mentioned, can be used to help you. If wearing full or partial dentures, ask the person to remove them. A patient that has a denture or partial denture should have their denture removed at night for sleep. Cleaning the denture should be done on a daily basis and can be done with a toothbrush and warm water. No toothpaste is necessary. In addition to brushing, an effervescent denture cleansing solution can be used as directed on the package. With smaller children, you might choose to be seated and have the patient standing in front of you. This will allow you to stabilize the patient's head to limit any sudden movements. Make sure you brush and floss the entire mouth gently but firmly. Older children can learn how to brush and floss their own teeth with some adult supervision. The special healthcare needs of individuals should be evaluated by a dentist at least twice a year, but may need to be seen more often if they have a high risk of oral disease. The dentist can also assess the patient's oral status and make recommendations for additional home care. Remember, it's your responsibility to make sure your patients have healthy and happy mouths. In addition to the patient's dentist, other helpful resources that may contribute additional information on how to care for your patient or loved one are the National Institute of Health, the Massachusetts Dental Society, Massachusetts Department of Public Health Office of Oral Health. Check with your local dental society or Department of Health for more information. Thank you for watching.